everyone. I'm Dr. Krista Burris, and I'm here with Coachella Valley Direct Primary Care to talk about the state of the coronavirus epidemic here in the Coachella Valley. And I'm here with Dr. Michael Kemp. And today is February 17th of 2021. And today we're going to go over our numbers for the Valley and talk a little bit about the next steps in the vaccine rollout here in California and in our county, Riverside. So I thought we'd start with our numbers today, as usual. And the first thing we're going to see here is our daily epidemiology report. So here we see that our new cases are continuing to gradually come down. Again, only 473 new cases. That's great news. We're still having quite a few probable cases being reported. Those are those rapid cases, 12,574. Now, it is important to know that some of those probable cases do include duplicates, either people that are retesting or testing to be cleared to go back to work and continue to test positive. So some of those are duplicates, but we still have a fair amount of disease transmission within the community. Also, as we go down, we'll see that our hospital numbers are continuing to drop, and we're down into the 500s, and our ICU numbers as well are slowly coming down. And so let's go all the way to the bottom. And what we'll see here is that our trend is continuing to go down as far as our positivity rates. So let's go all the way to the bottom of the slide. Aha, okay. So you'll see here that we've actually made it under 10%. So that means that of all the tests that are being done, only 9.2, it looks like, percent are coming back positive. This is really good news. If you remember back, several months ago, we were talking about the purple and red tiers. In order to get to the red tier, our positivity rate needs to be under 8%. So we're actually going to hit that fairly quickly. What is not quite at the level it needs to be to move down a tier is our cases per 100,000. And that needs to be at 7 in order to go down into the red tier. And currently our case rate is at about 29 per 100,000. So we still have a long way to go, but it is still moving in the right direction. I do not have, for our next slide, normally we do our District 4 Coachella Valley weekly report, but the county has not yet put that out because of the holiday. And so we may not get one this week. And so we'll just kind of wait and see what it shows next week. This slide is the hospitalizations that have been coming down, as we talked about before. And you'll see that red line is our total hospitalizations and the purple bars are our ICUs. So they are both trending downward and we're getting there. And then if we keep going down, we'll see that our new cases also seem to have dropped off precipitously. And this is really good news. This is also not due to the amount of vaccination we've been doing. I just want people to know it's because of everything else we've been doing. It's the closing back down. Once we closed back down and really ratcheted down the amount of movement in the community, there were a few weeks where we still had the burgeoning exponential growth, especially over the holidays. And then gradually those numbers sort of work their way out. And now we're finally seeing the fruit of our labors, as it were, and seeing our numbers come down. Vaccination rates should be able to drive us down even further as we vaccinate more of our population. and hopefully get us down to the low level of transmission or no sustained transmission, effectively just blips here and there. And when we've reached that point, that's when this pandemic or the epidemic locally is over. When the world has reached that state, that's when the pandemic is over. So let's go to the next slide. Speaking of vaccines. And this next slide is from the county, and it's looking at our vaccine situation here in Riverside County. As you can see, we've received about 350,000 or so vaccines in the county. And so this is good news. This is a long way towards where we need to be. And the county is doing a very good job at getting vaccines out and into arms quickly. The tier that we're in, let's go down to the bottom. The tier that we're in is we're all the way up to, I believe, 1B. So let's go back up a little bit more. There we go. So we're in phase 1B here. And what that means is that in tier 2 of 1B, we're vaccinating people 65 and older, and that's where we're in. The governor announced, I believe 2 days ago, that he wants the counties to start phase 1C on March 15th. So that's about a month from now. It looks like that's the goal for moving into phase 1C. And this means, that people 16 to 64 with underlying conditions can be vaccinated at that point. So just to give you an idea of how close we are to that, in the current phases that we're vaccinating, we have vaccinated about 3 million Californians, and there are 15 million Californians in the current tiers that we're vaccinating. So we still got 12 million to go. Our current rate of vaccination is 1 million per week. So that's only another 4 million of the current 3 million. So basically, by the time we've opened up 1C, we'll only be halfway done with the first tiers. That's going to create probably some additional stress on the system and on people who are very anxious to get vaccine. That also, if you're in these first tiers and you've been kind of putting it off and thinking, I'll wait a little while longer and get the vaccine. If you're thinking of getting the vaccine and you're in these tiers, it's worth taking the time to really make an effort to get your appointment before we've moved into this next tier. Because once we do that, there's an additional tens of millions of Californians who are going to be looking for vaccine at the same time. So it will probably be even harder to get it at that point. Even with the increase in the vaccine availability, if you've been paying attention, you've seen every week we've actually increased the amount of vaccine available in the US, which is great. That process is going to continue, but because we keep opening up the tiers, the demand is going to remain very, very high. So all in all, it's a good news. Everyone's a little impatient, and that's understandable. Having said that, I have a friend who has a website to help you if you're in search for a vaccine, and it's Vaxie, VAXIE.info. And I'll put a link to it in the comment section as well for this video.
And we need to preface by saying that's just the Inland Empire.
Oh yes, and Riverside County and some into San Bernardino, and And this is that is volunteer run. It is not the be all end all and doesn't bear responsibility for having every single up to date information. So know that as well. Don't get angry with them if something's missing. In fact, if you know of something, you can share it with the website and help keep that information resource as robust as possible. Um,
And you got to know that different counties will require you to show proof that you live there. So,
right. In general, you must live or work within a county to go to a county based vaccine clinic. So if you don't, make sure you double check that you'll be able to get a vaccine at that clinic before you take a spot. And for most people, they should be able to find something within their county if they're persistent. What else was I going to talk about? Oh, the new Johnson & Johnson vaccine. So on February 4th, the Johnson & Johnson company applied for approval of their vaccine with the FDA. This process usually takes about 3 months for them to review it, but it is being expedited. The next meeting of the Vaccine Advisory Committee, who's reviewing the evidence right now, will be meeting on February 26th and will give their recommendation after that meeting. And so probably the soonest we'd see that vaccine be approved, if it is going to be approved, which it doesn't look like there's any red flags right now, would be the end of February. And the company states that they'd have somewhere in the range of 7 million shots available within March, and then another 30 million by April. So it's not a game changer. They're not going to put out 300 million shots on the market, the week after they're approved. But I think we'll see that vaccine, if it's approved, quickly become a favorite in this next tier rollout that's coming with the pre-existing condition people, slightly younger people. I think we'll see that sort of really play an important niche. But some people have asked me, it's like, what's wrong with the FDA? Why weren't they just following it every step along the way in the study, and as soon as they've got the application, they could just go in and rubber stamp it? The reason is, for this one, the Johnson & Johnson trials for this vaccine have taken place all around the world in many different countries. So they have to go through reams and reams of data. I mean, we're talking about 65,000 people all around the world, and they need to actually go through the data carefully. So doing that in 3 weeks is really a monumental task. And so I want people to understand that there still is this process that must continue. And if they get to that meeting and they feel like they still have questions, they'll likely not approve it at that meeting. So that's still a possibility that I want people to know about. And that doesn't necessarily mean the vaccine won't be approved. It just means they want additional information about, say, a side effect that was noted in one of the studies or something like that. Dr. Kim, do you have any thoughts or comments on the situation this week, or problems you've seen with vaccine rollout, or even side effects or questions people have?
no, it's just a matter of supply and demand, right? The supply chain, there just physically isn't enough vaccine. And so every group wants, the vaccine, the whatever essential worker group you are, whether you're a teacher or a dock worker or a grocery worker or a healthcare worker. And so the problem is, how do you dole out small amounts, or do you just go through each category and make sure you get enough of those and then move on? And I think that's the problem we're seeing, is that, there's a lot of competing needs, which they all are valid, but, the the number of shots that each state gets, then it allocates to every county is the problem. And I think the Johnson & Johnson will help because it's a one-dose vaccine. But like you said, it's going to be another month or two for it to get out. So I think we're going to still kind of be in the same boat of, the numbers are going down. That's good. But, I think with the numbers going down, if we could hit the vaccines hard, that would be a better.
I worry actually a little bit that all of the vaccine demand is hiding a bit of the vaccine hesitancy in certain subgroups. Like I'm thinking specifically about some of our higher risk groups of people who have less access to the medical system or even some bad relationship with the medical system. If we take these groups out, and they're not being offered the vaccine as much, they're very hesitant to get it, and it's just making less of an inroad into those communities. Yet it's being hidden a bit because there's such demand overall from the population that we're able to kind of, just sort of overlook the fact that we're sort of missing some of these communities. I think they're looking at that very carefully right now, because right now only 16% of the vaccine in California has gone to people of Latinx descent, even though they make up 40% of the population. So that's a concern, because that population has a lot of essential workers who theoretically should have been able to be vaccinated already in this tier. And so the question is, are we missing them because they don't want to come and we need some kind of outreach to help address that kind of vaccine hesitancy? Or is it because they're not being offered the vaccine in a way that they can access, or a combination? So I think that is something to keep an eye on. And I know the state has sort of highlighted it a bit. We also have definitely we're behind in our vaccination within the Black communities, and they are trying to make some inroads to that in LA and in Oakland. So hopefully we'll see these numbers kind of even out a bit as the next few weeks go by. It's something to keep an eye
on. The other thing that I think that was too broad of a statement was the CDC saying that if you've received the allotted amount, whether it's one of the J&J or the two of the Moderna or the Pfizer COVID vaccines, and you're exposed, you're still good. You don't have to do anything. And while I can understand why that they would say that, I think it's too nuanced. There's too many variables out there, right? On your age and your immunocompromised status and your current medical status. And there are just a lot of different things that you need to think about rather than just saying, oh yeah, you got your 2 or your 1 shot, you're good to go. And so I'm a little worried that that's going to drive another bump, because people are going to be like, oh, I don't have to social distance, or I don't have to worry because I was exposed to someone who had COVID. So
I think that there's some new data that's about to be released that is, because I know the CDC has it right now, that shows the amount of virus that's present in patients who have previously been vaccinated who happen to contract COVID is much lower. That's the thought they think behind the CDC statement. But I think you're right in that there's so many variables. The question is, you don't know if you're one of the people that actually didn't respond well to the vaccine. So just to say, for a blanket statement, everybody's fine, does seem a little oversimplistic. I mean, if I knew I had been exposed to a COVID case without appropriate PPE, I probably would not pick the next 2 weeks to go visit a, highly vulnerable person. So I think, I think there's some nuance, like you said, that this blanket statement didn't address. I think they're running into that problem a little bit as well with the CDC's guidelines for schools. And I've seen them backtrack a little bit. I think we're still going to see this. I mean, we've seen this for the entire past year, but we're still going to see this as they try to move forward and they do the best they can with guidelines. But there's no way that they can put something out really that addresses everything, every possible scenario. And, honestly, when you see a lot of this backtracking, that tells you that they don't have enough people at the table to make these recommendations, that they don't have enough representation of different types of people there. Because if they haven't thought through all these nuances before the recommendations come out, they're forced to do it afterwards, and then they have egg on their face. So it's much better to put more people around that table. You don't just put administrators around a table when you're talking about schools. You have to also put people who represent janitorial staff, people who represent cafeteria staff, people who represent the bus drivers, people who represent the teachers' aides, special education. I mean, honestly, such a complex thing. It needs a super complex, well thought out recommendation.
Right. Well, the other thing is, I thought, like, let's say we take 10 of our friends and we went skydiving. Each one of us will probably pull our parachute at a different time. Some might pull it right when they jump out the door, and some people might wait till they're 1,000 feet above the ground. And so that's part of the problem too, is all these people have their own personal thoughts, and so it's not one size fits all.
Well, that's about all I have for today. I don't know if you had anything else.
No, I think that's it. I think we wanted to tell people, definitely the rates are coming down, but we got to be vigilant. I'm a little worried about this, Super Bowl gatherings and what that'll do. Hopefully it will just be a little blip. Hopefully it won't be anything. But I think if we continue to be vigilant, we'll be continuing this trend because we're still seeing positive cases that we test for. So.
Yeah, I am hopeful. We've come through the holidays, we've come through the surge, but I still want people to know our ICU availability in Southern California is still 0. So even though we keep coming down, we were just so high that we just need some more time. It's like we just got hit by a tsunami. And so now when we look at a 30-foot wave, we think, oh, I could surf that. No, not quite. It's like we need to wait for the surf to come down just a little bit more before we go out and swim. So that is where we are.
And we do want to let people know we have started our other show, which is your health, your personal health. So if you want to learn more about health in the Coachella Valley and your personal health in general, please join us in our next show. And we'll see you guys next week.